ilé-iṣẹ́ ẹ̀rọ ayélujára Diamond Vision Entertainment Network.
Ó kù Diamond Vision Entertainment Network DVEN ẹ máa gbọ́.
Ilé-iṣẹ́ ẹ̀rọ ayélujára Diamond Vision Entertainment Network ẹ máa gbọ́.
Wow. Hello and thank you for joining us. This is Ejeka Joso. Let's talk about it on DVN Online TV. I am Oluwakemi Agbeke. Today's topic is gynecologic cancer. Cancers that start in the female reproductive system are called gynecological cancer. The treatment depends on where the cancer started. But the good news part of it is that regular gynecologic screenings can find cancer at early stage. So all women, they are at risk for developing a gynecologic cancer, and the risk increases with age. You know, as you age, you have chances of having gynecologic cancer. But this does not mean, however, that all women will develop one of these cancers. With me today, my guest is obstetrician and gynecologist, Dr. Victor Olujobi. You are welcome to the program, sir.
Thank you for having me, Mrs. Agbekiade. It's a pleasure to be with you, and greetings to all the viewers.
Thank you so much, sir. Today, we're going to talk about cancer, but the cancer in women. Cancer that we can find in women. That is the gynecologic cancer. That's what we're going to talk today. What is gynecologic cancer? Because some people, when they hear the word cancer, they think about a death sentence. Dr. Olujobi, can you please throw more light on this? What is gynecologic cancer?
Thank you for your question. It's important to just highlight, to highlight that gynecological cancers are cancers that occur mainly in women, and that's why we call them gynecological cancers. And cancer can arise any part in the body. The commonest cancers are actually breast cancers, lung cancers. But in women, the gynecological cancers are cancers that are found in the reproductive organs of the women, right from the vulva, outside the vagina. You can have a vulvar cancer. In the vagina, you can have a vaginal cancer. And then at the neck of the womb, you can have the cervix, where you can have cervical cancer, which we'll mainly be focusing on today. And then you can also have uterine cancer. That's a cancer of the womb. And then you can have cancer of the fallopian tube, as well as cancer of the ovary. So all these are the cancers that are gynecological cancers. But by extension, sometimes people talk about breast cancers because women breastfeed, and it's a major organ in the female body, but men also have breast cancers, and that's why it's not really classified as a gynecological cancer.
Thank you, Dr. Olujobi. Thank you for that. As we have heard from Dr. Olujobi, he has told us about all the cancers that can be found in women. But the topic that we're going to talk tonight is the one we call cervical cancer. Because if he said that we should be talking about all the cancer that, that we can find in women, we have a lot. Yeah. The one that is very common among women is the one cervical cancer. That's the one we're going to talk about tonight. Dr. Olujobi,
Yes.
What is cervical cancer? And what is the main cause of that cervical cancer? And I know we have the common signs and symptoms. Can you please throw more light to this for us, please, for our people at home that is watching us?
Okay. Thank you for that question. Cervical cancer is a cancer of the cervix. And the cervix is the neck of the womb, is the entrance to the womb. And that's where the cancer develops from. And so that is cervical cancer. And cancer generally is just abnormal growth of cells. So if you have a cell in the body that is growing too rapidly and abnormally, then that becomes a tumor. A tumor is may be malignant or it can be benign. For example, you can have a tumor in the uterus, which is a fibroid, but that's not a cancer. And you can also have a tumor in the cervix. So the cervical cancer is caused primarily by a virus called the HPV, human papilloma virus. And the human papilloma virus is a virus that is very common. Most women in their lifetime, at least 80 to 90% of women, will be exposed to human papilloma virus at some point in their lives. But the good news is that the body clears the virus, and the presence of the virus does not leave any symptoms. You may not know that you have HPV infection, but if you're a younger woman, you can have HPV infection and your immunity will clear the virus. So we can test you for HPV at age maybe 25, and you find that there's a HPV virus infection in the woman's genital tract. But that doesn't mean she will develop a cervical cancer. But if the HPV persists and the woman gets older, that virus actually grows and sticks itself into the cells of the cervix and then starts changing the normal nature of the cervix and leads to a system where we call dysplasia, where the cells now changes from the normal cells to a dysplastic cell, which is an abnormal cell. A dysplastic cell is not a cancer. We call it a pre-cancer. And the good news about cervical cancer is that before the cancer is formed, there will always be dysplasia. There will be dysplastic cells, which are not cancer. And it can also stay there. Dysplastic cells can, if your immunity is good and intact, you can have cervical dysplasia for years, even 5 to 10 years before you form cancer. And that is where the role of having a pap smear or doing a HPV testing comes invaluable. If those tests are done, you can screen and find the dysplasia. If you treat the dysplasia, you can prevent cervical cancer and you can clear the HPV infection.
Thank you so much, Dr. Olujobi. Thank you for telling us the signs and symptoms of cervical cancer and the main causes of it. Thank you so much. My next question is, how serious is cervical cancer? A lot of people, they say, oh, if you have cervical cancer, you cannot survive it. Is it true? How serious is cervical cancer? And how can we reduce the risk of having it?
Okay, so in your answering your first questions, I actually didn't fully get into the symptoms.
Okay, yes,
If you can
tell us the symptoms and the sign before you go to the next question. Thank you.
Yes, so the symptoms of cervical dysplasia, where before the cancer is formed, may have no symptom. You may not see anything. There may be nothing evident, and there may be no complaint. And in early cancer also, there may be no signs. But as the cancer progresses, one of the signs you see may be abnormal discharge, and you can also have abnormal bleeding. You can have intermenstrual bleeding, where there's a bleeding between your menstruation. Some women have postcoital bleeding, which is bleeding after sexual intercourse. And in advanced cases, there may be weight loss, and there may be fatigue. There will be maybe pain in the lower abdomen. Those are the signs that you can find. And if a cancer is diagnosed at this stage, screening is no longer helpful. You have to examine the patient. You may find a mass in the vagina and you need to do a biopsy. And histology of the biopsy is what confirms that there is a cancer. So those are the symptoms that you may find, and then you can easily present to the doctor. And the seriousness is that when you have cervical cancer, if it's early stage, it can be cured. And it's important to use the word cure. We can cure early cervical cancer. If it's a late stage, then you start having palliative care, where you get supportive care, improve your quality of life, and we reduce symptom, pressure effects, and all that. But once you have cancer beyond stage 3, stage 4, then you generally tend to have a supportive care if it's advanced cancer. So if you have early cervical cancer, it is curable. And even some cases of early stage 3 cancers can be treated so that the patient will live reasonable and have a good quality of life afterwards. But the earlier presentation will actually give you a better prognosis and even the chance of cure. If you want to reduce the risk of cervical cancer, and I think that is the most important aspect of this talk today, they say prevention is better than cure. And it's also cheaper, that if you prevent something, you will actually save in terms of cost. In cervical cancer is actually the commonest gynecological cancer in low and middle income countries. So in places where the resources are limited and in a poor environment, the risk of cervical cancer or the incidence of cervical cancer is higher. And in developed nations, because of population-based screening programs, they have actually significantly reduced their rate of cervical cancer. But in Africa, in parts of Africa and many low and middle income countries, the incidence is still very high. But fortunately, this cancer can be detected early. Dysplasia can be found early, and you can prevent the cancer. And one of the ways will be the traditional doing a pap smear. So generally, a woman should have a pap smear at least from age 30. Once you get your 30th birthday gift from your husband or your family, you also see the doctor and get a gift of a pap smear. It really helps. They say a stitch in time saves 9. So it really helps to do that. But unfortunately, in the same areas where the incidence of cervical cancer is very prevalent, those are the areas where the screening is limited and people do not want to have screening. And that is really the problem that we have. And besides doing a pap smear, the most important way to reduce the risk is by having we call it, reducing the risk of cervical cancer can be classified into primary prevention, secondary prevention, and you can have a tertiary prevention. Primary prevention of cervical cancer is by giving a vaccine called the HPV vaccine, human papilloma virus vaccine. The vaccine is safe, and it is advocated really that women should have it before sexual exposure. In many countries, it's recommended that girls in grade 4 and up to grade 5 or in just before high school receive the vaccine. You just receive 2 vaccines. If you will not be sexually exposed, you receive 6 months apart or at year interval between 2 doses if you are below age 15. If you are above age 15, you may need to get up to a 3rd dose, which will be 6 monthly and 3 doses. So what it does is that it's a viral particle. It is not the virus, but something that resembles the virus, and your immune system will think is HPV. And it will now produce antibodies against the HPV virus. So whenever you get the virus, your immunity will mop it. And that virus will not be able to attack your cervix and lead to HPV. So that is primary prevention. Another aspect of primary prevention is lifestyle changes. Some of the risk factors to getting cervical cancer is early sexual exposure, is multiple sexual partnering, and also for women who have human HIV infection or who are immunocompromised, who have decreased or impaired immunity, they tend to also be at risk of cervical cancer. And also very important risk factor is smoking. So women who smoke are at a risk of developing cervical cancer. And the reason is because the smoking alters the immunity, and it also allows the cervix to acquire the HPV infection. So HPV vaccination and lifestyle changes, stopping smoking, stopping multiple sexual partnering, and will reduce the chance of getting cervical cancer significantly. Some countries have reduced by vaccination and lifestyle changes, has reduced cervical cancer incidence up to 80% of cervical cancer can be reduced just by this measure. But when you now come to secondary prevention, that involves doing a pap smear, where if you do a pap smear, you find the changes in the cervix, which is not cancer, but this is the dysplastic cells I spoke to you earlier about, that it will show on the cervix that these cells are not normal, and then we can treat them. And the treatment is just to remove that area of the cells by using a loop, just to cut off the small area, and then the patient follows up by doing pap smear or HPV testing to be sure that they are cured, and they will need a serial follow-up. So that's secondary. Tertiary prevention of cervical cancer is that there's already early cancer, maybe early stage 1 cancer, where we can also just remove that area of the cells of the cervix. You can do a cone biopsy to remove the area. If it's early stage 1A cancer, for example, you can remove those areas and you can treat the patient with surgery, and there can be, and you need to follow up the patient. If it's also early stage 1 cancer, you can treat the cancer and the patient can be cured of cancer. So those are the strategies, primary, secondary, and tertiary. But we do not want to see our women getting late stage cervical cancer.
Thank you, doctor. You said about the causes or the prevention. You made mention of smoking, that smoking can, trigger the risk of having cervical cancer. But you didn't tell us about drinking.
There is no direct link, scientific link between drinking and cervical cancer. Okay. Alcohol drinking has cardiovascular risk to a woman's health, but there are other risks from taking alcohol, but it's not, unfortunately for us, it's not a risk factor to cervical cancer.
For having cervical cancer. That's great. Yes. Thank you, doctor. You can call us at 647-526-0527. If you have any question that you want to ask regarding the cervical cancer, please feel free to call or type your question on the forum here. So I'm going to read it out. So please tell us about the diagnosis and the treatment of cervical cancer.
Okay, thank you for that question. So we really like to diagnose cervical dysplasia, not cervical cancer, like I said. Oh. And that you can find by doing a pap smear. Yeah. If your pap smear shows that there is cancer, then you need to have an examination by your doctor or by your gynecologist, and then they have to check the cervix. And if there is an abnormal area on the cervix, they will need to do a biopsy and send it for an urgent histology. So if the histology comes back and it shows it's cancer, then you also need to have other workup so that we prepare for staging of the cancer. So the sequence will be, first, we do not find cancer or we prevent it. If we have dysplasia, we can also treat that, and that is not cancer. But if you have early cancer and there's a biopsy is done, then the next stage is to stage the cancer, because you can only treat the cancer based on the stage. The treatment for stage 1 cancer is different from treatment for stage 3 cancer. So we do some blood tests, do ultrasound and check the kidneys. We check HIV status, screen you for diseases like syphilis, do blood tests, check renal function, and then we examine the patient, and then we stage in a multidisciplinary setting where you have a pathologist present, you have the gynecologist, you have the gynecological oncologists, which are people who treat gynecological cancers. And then you have all that team available. You can even have your radiologist present, and then we have dedicated plan for treatment of the cancer. So the treatment options, like I said, depends on the stage. Early stage cancer, very early stage 1A cancer can be treated with surgery. We just remove the abnormal area, get as much tissue as possible, and make sure there's nothing left. And then we follow up the patient. As long as that there's no lymphovascular invasion, where the abnormal cells have not gone into the lymph nodes or lymphatic channels of the cervix, then we can just treat with surgery. And then, but in slightly later stage of stage 1 cancer, we can combine surgery with radiotherapy. And then in other advanced stages, you need chemotherapy, and then you also combine that with radiotherapy. And then radiotherapy will be giving radiotherapy into the vagina, some to the abdomen, so that we kill all the cells, abnormal cells. But unfortunately, chemotherapy has some side effects because you're trying to kill the cancer cells, but sometimes it can affect some normal growing cells. But with time, those ones will also recover. Radiotherapy also has some side effects. You may have skin changes, you may have the vagina now becoming a little bit narrowed, but all that can be managed by follow-up and planning of the patient. So it's surgery, radiotherapy, chemotherapy for treatment, depending on the stage.
Thank you, doctor. We have one question, maybe the one that Miss Ronke Oshiemi, sign of cervical cancer. I thought you have said it. Maybe you can just help me to, summarize it.
Maybe she missed that.
Maybe.
So the signs is that there may be no signs. You may not have signs in early stages. But by the time you start having signs of cancer and there are symptoms that you can present with, like bleeding, offensive vaginal discharge, pain, or bleeding after sexual intercourse, or bleeding between your menstruation, weight loss, that is now becoming advanced stage. We do not want to get to that stage. And like we also said again, if you can take anything home from this discussion today is maybe if you have never had a pap smear and you are above the age of 30, you will need to please go for screening. And the screening, if you don't have access to HPV testing, that is the best screening. You can have a pap smear. And if you are HIV negative, at least a pap smear every 3 years, 3 to 5 years, will quite be helpful so that you can pick the abnormal cells even before they become cancer. And even if a cancer is found, it will be found very early and you can still have proper treatment and cure for this cancer.
Thank you so much. I have a question here from one of my audience. They say, how often will I need to have follow-up exams and imaging tests?
So I think maybe this question is talking about follow-up after treatment.
Yes, I think so.
After treatment. Yes, because you can have some imaging tests as part of your screening. But so follow-up would depend. In early, immediately after treatment, we want to check for recurrence. And most of the recurrence after treating cervical cancer is in the first few years, first 2 or 3 years is where the recurrence happens. So we increase the surveillance, maybe the first 3 months, every 3 months for the first year. Then you can go on up to every 6 months for the next 5 years. And then you do yearly. In some centers, they do that for another 5 to 10 years. And if you are cancer-free for up to 10 years, they can actually discharge you from follow-up. So it will require intensive follow-up in the first few years, and then subsequently there's nothing found. And during the follow-up, all we check is just to examine the patient thoroughly, check the cervix, do a speculum, examine the abdomen, check for lymph nodes, and also listen for any complaints that they have. If there's no complaint and the examination is clean, that means the patient has been cured and has remained cancer-free.
Thank you. And the next question is, how will we know if the cancer has come back? He said, what should I watch for? That's a question he said, how will we know if the cancer has come back and what should I watch for? That's what the question is.
Thank you for that. So in this case, it is important to have a follow-up. And your follow-up ideally should be with your gynecological oncologist. Those are the people who treat cervical cancer, and they are the ones who follow up these cases. In certain instances, if you do not have access to a gynecological oncologist, your follow-up can be dedicated to a gynecologist, and we do not want you to have symptoms. But one of the symptoms that is coming back is that you start bleeding again. You start having pain during sexual intercourse, or you start bleeding, or you start having weight loss, or you just start having abnormal discharge, offensive discharge. Then those could be the signs that the cancer is coming back. And before it comes back, we can pick the lesions if you have a normal follow-up, and they can still remove them or give you another cycle of treatment. But we don't want you to come with bleeding. And you cannot be treated for cervical cancer and then you stay away from your treating facility or your physician.
Thank you so much, sir. Another question that we've got is that it said, is it a woman that sent it or a man? They didn't put. It said, can I have a sex during treatment? Will my sex life change after treatment? I think that's a woman. This is not a man. He said, okay. Can I have sex during treatment? Will my sex life change after treatment?
Okay, thank you for that question. During the treatment, it may be advisable to avoid sexual intercourse because, for example, if your treatment was by surgery, you will need time to recover and heal from surgery and not damage the area where the surgery was performed. So immediately after surgery, maybe for a couple of months or weeks, it will be advisable to avoid sexual intercourse. But if after the treatment and you've completed your treatment cycle, or while you are beyond the active phase of your treatment, obviously human beings have other responsibilities beyond their health. It can be understandable if there's a need for sexual intercourse, but families usually will have understanding of the need. And most of the patients who have cancers are actually more particular about getting cure than pleasure. But we know that pleasure is important in the life of a woman. So it can be deferred during the treatment. And then once your clinician or your gynecologist recommend that there will be no damage to the area from intercourse, then you should be able to have intercourse. After the treatment is completed, some of the few things, if you had radiotherapy, is that the vagina may become a little bit narrowed. And then it can be painful during sexual intercourse. But all that can also be addressed by your clinician by giving you lubricants, and by also they can help you with dilating so that you don't feel pain. But that can be addressed. In advanced cases of cancer, where radiotherapy may affect the ovaries, and or if surgery was done and the ovary was removed, it may affect the woman's desire for sexual intercourse. But hormone replacement therapy can be given to support in this kind of instances.
Thank you. The next question that I got is I can't even see. It's as my cancer spread outside the cervix. That is how is it going to know if the cancer has spread outside the cervix? How should it know?
So the way you will know is during the staging. When we stage the cancer, we stage it from stage 1 to stage 4. So stage 1 cancer is confined to the cervix. Stage 2 cancer of the cervix has involved the womb. So initially it's at the neck of the womb, now it's gone to the womb, and stage 3 has gone outside of the womb. So out of the cervix, out of the womb to the surrounding, and it can affect even the pipe bringing urine from the kidneys, and it can lead to non-functioning kidney damage, and that's stage 3. Stage 4 is that the cancer now has gone beyond the pelvis. Some of them will go to the bones, can go to the lungs, or to the liver. So at that point, we already have advanced cancer. So cancer that has gone beyond the cervix is from stage 2. But stage 3 is completely out of the cervix and the uterus.
Thank you. Next question is will I need hormone replacement therapy after treatment? If so, is it safe?
Yes.
Will I need hormone replacement therapy after treatment. That is after treatment. And she's asking, if so, is it safe?
Thank you for the question. And it's a very important question. It depends on at what age the patient was treated for cervical cancer. If she was treated as a young woman before menopause, and she's not close to menopause, there may be a need for hormone replacement therapy if she had extensive radiotherapy and chemotherapy that affected the ovaries, or she had surgery where they had to remove, we do a radical hysterectomy in early stage of cervical cancer, and that may involve removing the womb as well as the ovaries. So if you remove the ovaries during surgery, it means that the patient is young, you will need hormone replacement therapy. And the hormone replacement is we're just giving you estrogen and progesterone. Those are the normal hormones that are produced by the ovary. But the only thing we need to be careful about is we don't want to give you progesterone if you have if you have breast cancer. We want to stay away from progesterone. Or if there is a strong family history of breast cancer, or you are carrying a BRCA gene mutation. It's a mutation that is associated with breast and ovarian cancer. So if you have that, we may be a bit cautious with giving you progesterone, but there are other medications that can be given. There are a few side effects that you can have from hormone replacement therapy. But if you do not get the hormone replacement therapy, then the bones become weaker, and then the women are prone to fractures. They now start having hot flushes, and their quality of life is really compromised. And there is real evidence that it's quite helpful to have hormone replacement therapy. And we want to start the hormone replacement therapy early. We don't want to wait more than 10 years from when you already have gone into surgical menopause or menopause because of your medical condition, and then starting it. So there's a window period where it must be started. And we do not also want to use it forever. You need to review, and at some point, we will have to withdraw the treatment, or it is reasonably safe, and your clinician will manage any side effect.
Thank you. Thank you so much, Dr. Olujobi. The next question is, what are the chances my cancer will recur, that is, come back with those treatments, with the treatment plan? Is that
Thank you.
The chance? Yeah.
Thank you for the question. The chance of recurrence depends on the stage. If it's early stage cancer that has been adequately treated, the chance of recurrence is quite very minimal. But once you start advancing in the cancer, then the chance of recurrence is actually higher as the staging is increasing. So we want to prevent cancer. And if we detect any cancer, we want to find it early. And with proper follow-up, if there is any signs of recurrence, that can be addressed by your team. But early cervical cancer is curable. It's not just treatable. We can cure it, and then we can follow up.
Thank you so much. Thank you so much. The next question is, what will we do if the treatment doesn't work, or if the cancer reoccur back? That is, maybe the treatment that the person has been, having is not working. What is going to happen?
Okay.
Is that any option?
Yes. There can be, for any condition that you are treating, and that's the reason why you should have an adequate diagnosis, and you should have a proper staging of the condition. And cervical cancer is usually managed in a multidisciplinary environment, like I said earlier. So right treatment for the right stage will reduce the chance of a treatment failure. And as you survey, and it also depends on the subtype of the cancer. So if you do a suboptimal treatment in the beginning, then you have a chance of failure. But if you get the right treatment, it's very, very small chance of the so-called treatment failure. There may be a small chance of recurrence in the future, but we can find that early and we can retreat again. It's virtually going back to the same modality of treatment, or readjusting the treatment or the dosage of radiotherapy or chemotherapy that the patient receives.
Thank you. The next question, it said, do I need to change what I eat during the treatment? During the treatment, is there any specific food or drink that the person has to, eat? He said, do I need to change what I eat during the treatment? Is that?
Thank you for that question.
Or it doesn't matter, you can eat whatever you like during the treatment.
Even when you are not on treatment, you shouldn't eat whatsoever you like. Healthy eating, healthy habits is recommended. And for somebody who has got a health consideration, it's recommended that you eat healthy. So I would just recommend healthy diet, and but there shouldn't be anything that I would say to you that is something that is completely contraindicated, unless you have another health condition that is coexisting with your cervical cancer. So assuming the patient has got diabetes, and now unfortunately there's cervical cancer, then you know that you need to reduce your calorie and be on your treatment. Or somebody who has got an autoimmune disorder, you need to make sure that you stay away from anything that will cause a flare of your condition. So, but healthy diet should be okay. But there's no specific diet that I would say that is contraindicated or is not necessary, that you cannot take if you have cervical cancer.
The last question is, how will we know if the treatment is working? How will you know that, oh, my cervical cancer has been cured?
So the signs of cure is that the patient's well-being will improve. The symptoms that she had before are gone. The one who has offensive vaginal discharge doesn't have that anymore. Weight loss has improved. Your bleeding has stopped. Your sexual life has also improved. Your quality of life has improved. You are even a happier person, and you can see from people around you can see that there is a change. So a successful treatment will mean that we have eliminated the cancer, and while you eliminate the cancer, you are also eliminating the symptoms and the signs that come with it. Recurrence will start small and you pick it early, and that's why there's a need for serial surveillance or follow-up of the patient. A diagnosis of the cancer, depending on the type of cancer, is not a death sentence. It depends, like I said earlier, on the stage of the cancer. We want to find every problem early, and the early you treat it, the better the outcome. So if there is a recurrence of cervical cancer, we will address it, and that also can be cured again. You can just reapply the treatment and follow up the patient.
So when it's reoccur, we should not, we should not be scared. It can be cured as well. Is that what you mean?
Yes. Yeah. So what I'm saying is that I do not want patients who have cervical cancer to think that they can remain on their own and they take responsibility for knowing when it comes back. Sometimes there may be no complaint, but your doctor will find that a small change is occurring. They may take a biopsy and find that there is already signs of cancer, and that may be located to a small area of whatever part of the genital tract that they could find it. And that can be removed either surgically or you apply radiotherapy and chemotherapy again. But if you have a recurrence that is advanced stage, then the chance of survival is quite remote. And but if you diagnose early, you can also cure a recurrence if it's early.
What advice can you give to people who have cervical cancer?
So those who have cervical cancer, I want to believe that they already have a clinician or a gynecological oncology team that's responsible for them. I would recommend that they stay consistent with their treatment. I know some people will want to pray about these conditions. I believe in prayer, but it's also important to allow your doctors to check you up and make sure that your prayer is working and your prayers have been answered because they can't find any lesion anymore. So it is important to stay with your doctors and follow a follow-up plan. Number two is that they need good social and family support. Sometimes it may be important to have a caregiver or a family member or a spouse to come to the clinic so that they can be educated about the condition and they can have support. Sometimes you may also need to be in find a team of people who maybe have the condition in the clinic where you can relate with and you can understand their how they overcome this their specific conditions. So it's like having a peer group kind of a setting to support.
They can have counseling as well, like mental, professional.
Yes.
Okay. Thank you so much. Thank you so much, Dr. Olujobi. That was a wonderful talk tonight. Thank you so much. We appreciate you for coming to DVEN program. Thank you for coming. And to the viewers at home, thank you for being there throughout the program. Thank you so much. God bless you all. I still remain Olúwakẹ́mi Àgbékẹ́adé. Ẹ má bínú fún gbogbo èyí tẹ́ ti wò wá pé èdè òyìnbó la sọ ní ti alẹ́ yìí torí pé a fẹ́ káwọn kan náà kí wọ́n kópa níbẹ̀ ni ẹ má bínú sí wa. Thank you so much once again, Dr. Olujobi, for coming. I appreciate you. Dr. Olujobi, do you have anything to say before we go on this program?
No, mo dúpẹ́ o. Àwọn tí wọ́n fẹ́ gbọ́ èdè Yorùbá tí wọ́n rí gbọ́ lẹ́nu mi, ẹ má bínú. Ó ṣòro láti sọ pé cervix àti ovary ní Yorùbá ni. But bá ṣe tún sọ náà pé a fẹ́ kí àwọn tí ò gbọ́ Yorùbá wọ́n lè gbádùn ètò yìí ní òní. Ẹ má bínú. Ọmọ Oòduà ni mí and inú mi ò bá dùn láti lè fàyè sọ̀rọ̀ ní Yorùbá. But thank you for accepting me this way. And it's a pleasure to be in this program.
Thank you, Doctor. I think we have somebody here again. Oh, Chris Akigbade, Mr. Akigbade, thank you for joining us. He said, Doctor, thank you, Doctor, for your explanation. Yes. Doctor did a very wonderful talk tonight. Yes, you are right, sir. Can I ask another question? Ms. Ronka, we're about to go, but let's give you time. You can ask one question, ma. Just go ahead. What is your question, ma? You can call us or you can write it on the platform there. Okay, someone is calling. Let me see. Oh, sorry, I missed that call. Someone called me just now. Let me call back. Hello, sir. Emma Binu, we missed your call. Hello, sir.
Okay. I just want to greet the doctor. Dr. Olujobi.
Sure.
I just want to thank you for the explanation you have given on these gynecological cancers. They're actually common cancers anyway.
Yeah.
And as you have said, all these things are not death sentences when somebody has cancer. So all we just need to do is that we need to treat everybody that has cancer with respect. We just have, so we shouldn't run away from them because we always have this emotional thing that when somebody has cancer, that person must be from another world. So we begin to treat somebody with any sickness as if they are strangers. No, we shouldn't do that. So I thank you for your explanation. And I know that when somebody has something, that person should speak up. A lot of people, they have things, but they don't say it out. Until when things have become so bad that now when they're even carrying them about, they don't even know because the sickness has already eaten deep into them. So I just want to tell everybody, whatever thing that comes up, we should just say it out. Because you don't know in the process of saying it out quickly, somebody may have a solution or somebody can lead you to a source of solution. So I just want to tell everybody that no, all these things are natural. There's no control that we have over them. So, Doctor, once again, thank you so much. And you are blessed indeed. Thank you. Otumba, you too, thank you for the program.
Thank you so much, Mr. Kimbade. Thank you for being a wonderful supporter of DVEN TV. Always. Thank you so much. We appreciate you, sir.
Thank you, my sister.
All right, sir.
Bye.
Bye. Well, Ms. Ronke Oshiemi, we've been waiting and we have to leave. We don't have much time to stay on this program anymore. If you have your question, just feel free to send it to me, and I'm going to forward it to Dr. Dr. Olujobi, Dr. Victor Olujobi. So my people at home, stay blessed, enjoy your weekend, and we are going to meet by God's grace next week for another beautiful topic. It might be in Yoruba, it might be in English as well, but for a wonderful topic that we're going to discuss on this platform again. Till then, take care. We shall meet by God's grace. Bye.